Hi there, I'm Chloe. I'm 26 years old. I live in North Richland Hills, Texas. I have about 5 years experience as a nurse. I spent a year and a half on med-surg oncology when I first became a nurse. I have a lot of experience dealing with patients that had depression and anxiety due to their cancer diagnosis that were also going through chemotherapy and radiation. I then worked about 3 years in a pediatric emergency room that actually had its own inpatient adolescent psychiatric facility that accepted patients from all over the county. So we saw a lot of pediatric psychiatric patients, somewhere upwards of 10 patients per shift. And now I work in an OR with orthopedic and spine patients, and our patients have a lot of pain, which can cause depression, and then they also have a lot of anxiety due to surgery. So I deal with that more on a daily basis now. I live about 2 hours from UT Tyler, so the requirement of going 1 to 2 times per semester would be no problem for me. I actually do prefer the online learning because I can work more at my own pace and it's a lot more convenient and personalized to me because the class is obviously just me. I did my BSN all online, so I'm very familiar with online learning and I had no issues with it. I plan on switching to 10-hour shifts at the first of the year. I've already spoke with my manager and we are arranging that, so I'll have an extra day to do assignments. I have an MP I work with who's actually a UT Tyler alumni that recommended the program to me, and that's why I decided to apply here. I think the role of the student is to be willing and eager to learn, set aside time to get their assignments done by the meeting deadline, and also ask for resources when necessary. I think a teacher should be encouraging to students, supportive, available, easy to communicate with, and posting assignments in a timely manner. I've helped precept a lot of new nurses when I worked in the pediatric emergency room since I had been there for so long. I worked a lot in triage, so I helped them with a lot of the triage protocols we had, as well as the trauma and critical care protocols that we had. So I really hope you take me into consideration. I'm really excited for this journey.